What is chemotherapy? The term chemotherapy refers to drugs whose action is to prevent or block cell division in order to destroy the cancer cells or inhibit their growth. The collective name for these drugs is cytostatics. How is chemotherapy administered? Cytostatics are usually administered in the hospital via an infusion. Your doctor may suggest that you have a central venous catheter fitted for the duration of your treatment. This catheter allows the doctors and nurses to administer liquids and take blood samples easily and safely. An example is a portacath, or a peripherally inserted central venous catheter. Chemotherapy may be given as adjuvant treatment. In that case, chemotherapy is given in addition to curative treatment, for example, after surgery. It can also be given as a neoadjuvant treatment and is then given before surgery to reduce the size of the tumor so that it is easier to remove, or as palliative treatment. In that case, chemotherapy is aimed at inhibiting the disease and alleviating or preventing symptoms. Palliative treatment does not cure the disease. The treatment or combination of treatments you are prescribed is always tailored to you as a person and also takes into account your general condition, the type of cancer, and the extent of your illness. Chemotherapy treatment consists of several cycles. One cycle consists of one or more administrations of cytostatics, followed by a break. That break gives your body the opportunity to recover. Before the start of every new cycle, your blood counts and condition are evaluated. A new cycle can only start when your blood counts and general condition allow it. Unfortunately, the cytostatic drugs do not only interfere with the division of cancer cells, they can also have the same effect on healthy cells. As a result, all kinds of side effects can occur. The severity and type of side effects depends on the cytostatics used, but also vary from person to person. You may have a lot of side effects or none at all. Having side effects says nothing about the efficacy of the chemotherapy. What are the possible side effects? Cytostatics have a very good effect on cancer cells, precisely because they are rapidly dividing cells. But healthy cells can also divide rapidly. A few examples. Their effect on the bone marrow results in a low white and red blood cell count, or low platelet count, which increases the risk of anemia, infections, or bleeding. Their effect on the skin, hair, and nails may result in temporary hair loss or nail damage. Their effect on the oral mucosa can cause taste alterations, but also mucosal inflammation or ulcers. Their effect on the mucosa of the gastrointestinal tract may lead to nausea, vomiting, and diarrhea. Medication can be prescribed to minimize the side effects. Examples include medication to prevent nausea or to stimulate the growth of the white blood cells. Your healthcare providers will discuss with you how best to deal with the side effects. What can you do to prevent side effects or reduce their severity? How can you monitor your side effects at home? Which signs, such as fever, should you contact your specialist or GP for? It is very important to report any side effects, no matter how minor, to your healthcare professionals, so that appropriate treatment can be started. Some side effects may occur immediately or after a few days. Other side effects occur later and may become worse after each treatment cycle. If you have any other questions about this topic, do not hesitate to get in touch with your healthcare providers at the hospital.